Hello, good morning. How can I help you?
Hi, good morning. My name is Louis Stephen. This is my first time to come to this place. I'm here to check my pregnancy.
Oh, that's great. Would you mind if I ask you to fill this form about your general identity? And after that, I will ask you some questions as a procedure for every new client.
Go ahead, I'm okay.
How do you know if you are pregnant?
Last month, I have been realized that I didn't get pregnant yet, but in my count, I have been 2 weeks late. So I took a pregnancy test and the result that was positive.
Oh, congratulations! Did you bring your pregnancy test result?
Yes, I broke my pregnancy test result.
The result was two lines, it means positive. When the exit date your last period was?
I keep tracking my menstruation period this entire time, and according to my notes, my last period was on December 19 last year.
Okay, wait a second. Let me calculate how long your pregnancy. It looks like your baby is about for 7 until 8 weeks and the due date around 26th of September 2021.
Okay, great.
This is your first pregnancy? Have you ever had a miscarriage?
Yes, this is my pregnancy. I have been just married for 3 months, and then I have a 8 weeks child in my belly. Quite fast, isn't it?
Oh, you are so blessed. Have you ever go to general practitioner or OB-GYN to get consult for your pregnancy?
No, this is the first healthcare facility that I come since I found out I pregnant.
Do you have any disease such as heart disease, asthma, lupus, diabetic, hypertension, liver disease, or any kind of transmitted disease like HIV?
In my acknowledgement, no.
Okay, here we go to last questions. Do you have any allergic to drugs or food?
I don't have any history of drug allergic, and I'm totally fine with every food.
Okay, good. Before you get examined with Mrs. Julia Robinson as the midwife, I will check your vital sign first. Okay, your blood pressure is normal.
Thank you.
Please wait here for a moment. I will let Mrs. Robinson to know that she has another client.
Never mind. Thank you.
Mrs. Stevens, I think this is your turn.
Hello, Mrs. Stevens. How do you do?
How do you do too? Thank you.
Thank you for choosing my birth care center as your healthcare facilities for your pregnancy.
My pleasure, Mrs. Robinson.
Okay, so how's your pregnancy going? Do you find any difficulty?
I didn't know getting pregnant would be this hard.
It's okay. You've been doing great so far. Would you mind sharing it with me?
It's really hard for me to eat. Every time I take a meal, I always end up feeling nauseous and sometimes I throw up. Even I can't eat my favorite food neither, and it's really stressful.
Actually, nausea and vomit is very common in first trimester of pregnancy. I'll explain to you why that's happened and how to handle it in the end of the session. Is there anything else or any discomfort you had during your pregnancy?
Everything is fine, but the nausea feel is the biggest concern of mine.
Okay, Mrs. Stevens, according to your last period, we predicted that your baby is about 7 until 8 weeks. We can't palpate or hear the baby's heartbeat yet, so I will recommend you to get ultrasonography tested with your OBGYN.
Okay, I will check.
But for your concern, nausea and vomit is very common in first trimester of pregnancy. Why? Because at this state, the placenta is being developed. Placenta is the factory of nutrient for the baby. Like we build the house or the factory, there will be a waste. Waste of the placenta development is called beta HCG or beta human chorionic gonadotropin. This waste will be excreted in the urine. So the conclusion is, if you drink less water, this waste will be stay in your body and keep make you feeling nausea. So you have to drink enough water so the waste will be out from your body. You better drink minimum 3 liters a day.
Oh wow, I could imagine that.
Good. Good. I will give you a prescription to reduce nausea, but first try to follow the recommendation that I've explained earlier. If it's not effective enough, you may take this drug according to the dosage.
Okay, thank you.
As for the diet, I suggest you to eat in small portion but often. You can use an aromatherapy such as citrus or peppermint to reduce your nausea feeling. I recommend you to eat foods that contain high protein such as red meat or fresh fish, and also eat vegetables and fruits.
Okay, I'm not.
Is there anything else that bothering you, Mrs. Stevens?
Your explanation is more than enough, Mrs. Robinson.
Okay, great. This is your medical record book. You have to bring it everywhere, especially when you are going to check your pregnancy. And for the next session, I would like to see the result of OBGYN consult and laboratory test.
Okay, I will keep it in mind. Get a supplement and vitamin.
Of course you are. I've been write a prescription so you can get it in pharmacy. I give you a folic acid vitamin, which is very good in first trimester of pregnancy for the development of your baby brain and central nervous system.
Okay, I get it.
If you don't have any question anymore, I will end up this session right now. Your next session will be 1 month later. Make sure your husband will be join us next time.
Yes, I will make sure that my husband will make it next time. Okay, thank you so much, Mrs. Robinson. It's really nice to have a conversation with you.
Pleasure on me, Mrs. Stevens. Stay healthy. Goodbye.